Just want to welcome everybody today to our dental provider training. My name is Jason Stewart, and I'm the operations director for Medicaid. And we wanted to set up these discussions and these trainings with our dental providers. We're looking to continue to do these monthly, at least in the interim, and then if we need to, maybe bump them to every other month. But since we've migrated to a new system, kind of being able to walk you guys through the new processes within the new system, kind of around the dental side, understanding there's quite a few changes that happen from our legacy or our previous system into our new Prism system. And so we just wanted to be able to take the time to meet with providers and to share with you kind of the questions that we've been receiving or the calls that we've been getting, so that you guys can kind of have them in one place. And then also, so we'll go through a couple of different slide presentations and some walkthrough through Prism, and then we'll go ahead and turn the time over to each of the staff. And then once we're done with all of that, we'll do some additional Q&A from some of the questions that we've received via the email, and Shandy will kind of lead that. And so for today's meeting, we're going to be using Google Meet functionality. And so we are recording this call. And so for part of that, we'll be able to share the contents of this call after the meeting. We will share with you guys the call recording. We'll share with you the slideshow, so you'll have a copy of that. And we'll also share with you the list of the questions that we've received and then our responses back to those as we complete those. So we'll send out a link to all of those that were invited in this call for that information, where it will be posted to our website. It takes a little while for the recording to show up, so that probably will go out in the next couple of days. So you'll have a copy of that as well. So just some housekeeping pieces there. Some of the ways that we're doing our training, we're doing some screenshots. That's because we're just making sure that we don't have any issues around personal health information. So that's one of the things that we're not sharing. One thing too is we do our Q&A. We also ask the providers stay away from PHI or questions around PHI or posting any chats that contain PHI, just because we are using this in the training, and there's several others in the call. As I stated before, we'll have the recording after the meeting, and then just if there's any disruption there, we'll kind of give you kind of heads up there. If it's bad, we'll need to remove them from the meeting. So let's move on to the next slide. All right, so today we have several of our folks in different areas that will be presenting and talking through some of the questions or areas that they've talked through or had questions from providers on. And so the first area we're going to have will be provider enrollment, and Justin Olson will walk through his slides.
Wonderful. Thank you, Jason. Good afternoon. My name is Justin Olson, and we also have Debbie Walker. We are the health program managers for provider enrollment. The first thing that we wanted to discuss was the profiles needed to manage a provider's information. So in order to manage a provider's information and access the business process wizard, the BPW, the profiles needed are EXT, Provider Account Administrator, and EXT, Provider Credentialing Specialist. These profiles will select the Manage Provider information in the Provider dropdown at the top of the Prism home screen. Provided is an image of the Provider dropdown with the Manage Provider selection boxed in red. I will address some of our most common calls or questions first. Provided is an image of the most common calls provider enrollment receives. I will cover these individually now. So the first one is all required steps will need to be reviewed and ensure that all fields with an asterisk are complete and correct. So in the BPW, the account administrator or credentialing specialist for the provider will have to select each required steps to confirm that all of the required fields marked with an asterisk have been completed. Provided is an image of the business process wizard steps with the required column boxed in red. Another common call is remember to answer all the questions in the enrollment modifications checklist. Provided is an image of the enrollment modification checklist. Another one is to upload all the required documents. The specialty selected in the specialty step will determine what documents are required. To determine what documents are required, you can click the required credentials button at the top of the screen. Provided is an image of the provider document list with the required credentials button boxed in red. Also, remember to submit the application modification for review. Once you click the submit modification request for review, the final submission screen will appear. If you agree that the submitted information is correct, you will click the next button at the top of the screen. Provided is an image of the business process wizard with the submit modification request for review boxed in red. And the additional image is an image of the final submission with the next button boxed in red. The next step is the provider enrollment terms and conditions. Once you have read and agreed to the terms and conditions, you will click the checkmark box, then click the submit button at the top of the page. This will bring you back to the business process wizard steps in the with the submitted for state review notice at the top of the page. Provided is an image of the terms and conditions with the checkbox and the submit button boxed in red. Also, the other images of the business process wizard with the submitted for state review in red. We will now move on to individual steps. The remainder of our presentation will quickly review the locations, ownership, mode of claim submission, associate billing agent, and the 835 ERA enrollment forms steps. Step-by-step instructions can be found on our website. We will talk about locations first. Step 2, locations. This step will be required for an enrollment type of FAO, group, or if the individual sole chooses the applicant type individual sole. And then you will want to click on the blue primary practice location hyperlink. Provided is an image of the locations list with the primary practice location selection boxed in red. This will bring you to the add provider location screen. All fields marked with an asterisk need to be completed if they haven't been completed previously. This includes the hours of operation fields. Remember to click the validate address button if you have updated any of the required fields and when the form is complete. Provided is an image of the add provider location with the required asterisk selections boxed in red. PRISM requires a total of 4 addresses: location, correspondence, remittance advice, and pay to. Click on the add address button located under the address list header to add additional addresses if needed. Provided is an image of the add provider location screen with the add address button boxed in red. We will now go over the step to add mode of claim submission EDI exchange. Choose billing agent clearinghouse UHIN if submitting claims through a billing agent clearinghouse or UHIN. Select the available transactions given by the billing agent or clearinghouse by clicking on the transactions and then moving it with the arrows over to the associated transactions. More than one transaction can be moved over to the associated transactions. In order to complete the EDI process, you must complete the electronic transaction type information in step 9, which is the associate billing agent. So if you update any information in step 8, you must also update step 9. If you choose direct data entry for fee-for-service claims, will be submitted using PRISM. The paper claim selection does nothing. We are no longer accepting paper claims. So again, if you update any information in step 8, you must update step 9. Provided is an image of the direct data entry section with the direct data entry button boxed in red. We will now discuss the associate billing agent step. Under the associate billing agent header, you can review the information of the billing agent ID, billing agent name, association start date, and association end date. You can update the start date to the date of the contract with the billing agent, do not change the association end date. Again, if you update any information in step 9, you must also update step 8. Provided is an image of the Managed Billing Agent Association section with the association end date field boxed in red. So, and to add a billing agent, you will click the Add button located under the EDI Transaction Authorization header. This will open the Associate Trading Partner ID page. From the drop-down Electronic Transaction Type, you select a transaction type. Again, if you update anything on step 9, you must update step 8. Provided is an image of the EDI Transaction Authorization section with the Add button boxed in red. So then you enter the trading partner ID number or submitter ID number provided by your billing agent or clearinghouse in the format of HT followed by 6 numbers, a dash, and 3 more numbers. These HT numbers will be assigned to the transactions you selected in step 8. Again, if you update anything on this step, on step 9, you must update step 8. Provided is an image of the EDI Transaction Authorization section with the completed EDI transaction types. And the last step that we will be discussing is the 835 ERA enrollment form. The 835 ERA enrollment page shows basic provider information, provider identifiers, provider contact information, submission authorization, and remittance advice. The remittance advice information is an important part of the provider enrollment process because this is where the provider chooses how to receive their 835 EDI remittance advice data. You have 2 options: electric RAs, which will be sent to the clearinghouse TPN listed in the associate billing agent step, or paper RAs, which will be uploaded to the Prism My Inbox. Provided is an image of the electronic remittance advice information section with the method of retrieval dropdown shown. I will now hand my time over to Diana to talk about EDI, or electronic data interchange.
Hello, everyone. My name's Diana Roof. I'm the EDI manager for MedOps. Let's talk EDI. To start off with clearinghouse challenges. Many of you may have experienced missing files or rejected reports from clearinghouses. Here are some of the most recent items that we've been able to resolve by working with Dental Exchange, Tasia, Claim Remedy, also known as Waystar, and Apex. The PA qualifier, patient loops, subscriber segments, and the SV3 quantity segment, as well as files containing duplicate control numbers. All of these items were HIPAA compliance issues. We also asked the clearinghouses to consider changing from single STs to multiple ST formats. What this means is a multiple ST allows individual providers and or individual claims to be marked for rejection rather than the entire file rejection when there is only one claim technically that's causing the issue. I'm happy to report that most have changed to this format. If you're using another clearinghouse or practice management software and are struggling to help them understand the required changes, please reach out to my team for help. Our email along with our telephone number will be listed at the end of this presentation. Now let's talk about primary insurance. You may also know it as TPL. Utah Medicaid now requires a CI qualifier to be used when reporting primary insurance. This qualifier belongs in the 2320 loop and more specifically within the subscriber segment SBR09. Please follow up with your software support or practice management software to find out how to add this information into your individual software programs if this has been an issue for your office. Now we're going to review how to download the paper remittance, and then we'll follow that up with how to download the 835 electronic file. We'll start with paper. In the past, paper remittances were mailed to the provider's pay-to address due to heightened concerns for PHI and cost savings for providers and for Utah Medicaid, a decision was made to stop mailing paper remittance in favor of a downloadable PDF format. In order to access these remittances, you and your staff will need an individual login. Once enrolled with a username, any one of the following profiles will allow access to the My Inbox area where the paper RAs are stored. These profiles are claim submitter provider, claims inquiry provider, claims processor provider, and EXT EDI analyst. The next few slides step through the directions, how to view the paper RA in detail, and how to download the 835 electronic file. Instead of reading through those slides, I thought it would be helpful to see the navigation in real time. Then we'll finish up with some final screenshots of the RA list for downloading the 835 electronic RA. When logging into Prism, the first thing that you'll do is make sure that you're looking at the domain that you wish to check the paper RA or electronic remittance. Then you'll choose the profile that you're needing, which are one of the 4 that I listed. I have a preference for the EDI role, so that's the one that we will choose now, and then click on Go. Once Prism has pulled up, you'll look in the upper left-hand corner and find the My Inbox tab. Click on it one time with your left mouse button, and then you'll find where it says Archive Documents, and click on where it lists right below that Archive Documents. Another screen will appear with a search window. In the search window underneath Archive Documents, you'll leave the all in place. You'll go to the second box where it talks about filter by, choose document name, and then literally you type in paper RA and then click on Go. If you're looking for a specific RA, you can look for it by scan date, which is equal to the pay cycle date, which is a Monday date in the Prism system. Once you find the RA that you would like to download, you click on the blue hyperlink one time, and then depending on your browser and depending on your computer setup, it should automatically appear on your screen. Due to PHI, we won't be able to go any further than this on the screen. But I did want to point out that in the upper right-hand corner, again, depending on your browser, you may have a down arrow that looks like this, where it will offer you the save option. I believe if you're using Edge, instead of seeing the down arrow, you will see a picture of a disk that you'll click on, and you'll get the same type of window. You can change the name here if you choose, and then make sure you note where it's going on your computer, and then click on Save. Once saved, it may automatically open, again, depending on your browser settings, or it may offer you a way to get to it immediately. Now we'll jump over and look at how to do the same thing with your 835 file, the electronic version. I'm going to go ahead and close out of this screen. And then if you're already signed into Prism, if you're in a role that doesn't allow you to view EDI or to get to the 835 link, make sure that you are in the right profile. And you can do that by clicking on the drop-down arrow here and then seeing that you're in which profile. As you can see, I'm in the EDI analyst, so I will go over to claims, choose the drop-down for RA list. Once you click on the RA list, you'll get a filter by page. Under payment summary, you'll change that filter by to billing provider ID or whichever field that works for the search that you need to do. I always recommend using the NPI. And then you would type in your NPI. I'll type in our test NPI just so you can see. Oops, 7511. I don't have any associated files in here, so we're going to jump back over to Prism. But normally you would just click on the Go button, and then in this window you would see all of your RAs, historically speaking. If Becca feels, bring us back to the presentation, thank you. Now you'll see where the billing provider NPI was chosen, NPI number would appear in the box to the right of that. And below that, in the far left, you'll see RA number column. And below that, you'll see an RA number. That is a clickable link, which is indicated in blue. You would click on that one time, and then it would open up a similar window that we just saw that will ask you where you want to save it. I would like to point out that this is the X12 version, or the HIPAA compliant file that you would be downloading. Normally speaking, you would want to go through your clearinghouse to get this file. If for some reason they're unable to provide it to you at any given time, you're always able to come back and get it from Medicaid with this login and download. And Becca, can you go to the next slide, please? Thank you. If for some reason you do need to download it, you do need an X12 reader. And that typically is going to be your practice management software. It will open in any type of text reader, but it does require you to be able to understand the X12 formatting. And then just like to point out one last time, depending on your browser, you may have different options. And if you have any questions, please reach out to our team. And now I'm going to turn our time over to Miss Emily for claims help.
Thanks, Diana. Hi, everybody. I'm Emily Stahl. I'm the supervisor over customer service. I'm sure I've talked to some of you. Today, we're going to actually go over some common issues when adding primary insurance to your DDE claims. But first, I did want to mention, we do not require you, or we are not required to require you to send in attachments. So please do not. That's not a requirement for us. It could actually cause your claim to reject. We have had that happen. If you do need further information, you can go to the dental provider manual. It is on page 10 in section 11. We'll give you a little bit more information there. All right, we'll go ahead and dive in. In this section, we're going to be discussing how to add primary dental insurance to your claim. This is a DDE claim. You will need one of two of the profiles listed. You'll either need the claim submitter or the claims processor provider profile. To start the submission process, you will need to select the claims tab at the top of your page to begin. Then scroll to and select the Submit Dental. A new screen will appear. Provided is an image of the Claims tab and Submit Dental option boxed in red. Excuse me. Okay, in the first section, you will begin filling out the provider information. After completing the provider section, you will then start the beneficiary information section. The beneficiary section is where the option to choose yes or no for primary dental insurance. Only select yes if the member has primary dental insurance. Provided is an image of the provider information section with the billing provider information selection boxed in red. Also included is an image of the beneficiary information with the does the beneficiary have insurance other than Medicaid question boxed in red. Okay, next slide is if yes is selected, in a drop-down section, and it is named other insurance information will appear. In this area, you will need to fill out all of the information that is provided to you from the primary EOB. The required fields are indicated with an asterisk. The external adjustment reason code and the adjustment reason group code are also required, but are not indicated with an asterisk. Make sure to add the total amount that the primary has paid on the claim, the whole claim as a whole. Provided is an image of the other subscriber information with the required fields boxed in red. Okay. Once the primary insurance has been added to the header level, you will then need to complete the claim information as well as the basic line information sections. Be sure to click on the Add Service Line item. Provided is an image of the Add Service Line item with the button boxed in red. Okay, after all the claim information is added, scroll to the bottom of the page to add the line level primary insurance. Click on the insurance info text. This does not look like a hyperlink, but should be used as one. As Diana had said previously that the hyperlink is in blue, this is not in blue, so you will just have to make sure that you see that information info text. Provided is an image of the previously entered line item information with the insurance info boxed in red. Okay. A new page will open when you click on insurance info. Here is where you add primary insurance at the line level. All fields in this section are required. Make sure the yes option is selected for the does the beneficiary have insurance other than Medicaid question. In the primary payer responsibility field, use the drop-down arrow to choose CI for commercial insurance. Use the drop-down arrows in the external external adjustment reason code and the adjustment reason group code to select the correct code found on the primary EOB. It is important that all the line amounts equal the header level total amount that primary has paid on the claim. Once information is filled out, click on Basic Claim Form to save. Then click Close to return to the main screen. If there is more than one service line, you will need to repeat these steps. Okay, so root canals. I think we all know that we have had many calls and questions on root canals. Here are some basic billing examples of, we do know that the root canals do need to be billed before the x-rays. So if you want to just go over the billing examples, I'll go ahead and read those bullet points. Root canals will not pay if the x-ray normally performed on a prior date of service is billed and paid before the root canal is billed. If billed this way, the system editing will group the root canal with an x-ray as a bundled service. Okay. Prism pays sequentially, which means if the claim is billed with the date span, listing both the x-ray and the root canal, the system will only pay the x-ray as it was done prior to the root canal. Okay. Dental providers have to wait to bill the x-ray until after the root canal pays. Policy has investigated the issue and the x-ray code D0220 is billable with the root canal codes. Providers can bill the root canal codes D3310, 3320, 3330 with procedure code D0220 on the same claim in any order. If the claim was submitted 9/29/23 or before, the provider can either submit or adjust their claim. So we do know some are out there that have not paid that way, but if you do go in and adjust your claim, it will now pay. And if you have any other questions, you can go ahead and call customer service and they can help walk you through that. That concludes the primary insurance section of our training. I'll go ahead and turn it over to Shandy.
Thanks, Emily. Good afternoon. My name is Shandy Adamson, and I am the Office Director for Medicaid Operations. We serve our providers with provider enrollment, EDI, customer service, and our policy folks are also on here. If you need to contact them, we'll go over some questions in just a few minutes that will direct you to the policy group for answers. So we wanted to make sure that you have that email here. Our resources are available also. I just want to let you know that there are a lot of resources out there on our Medicaid website. If you have not spent some time out there looking, I would encourage you to do so. There are step-by-step instructions. There's some training links. We've got PowerPoint presentations. And there's also just generally frequently asked questions. So under our provider tab, as well as our Prism tab on the Medicaid website are probably the most helpful to start out with. We want you to know that the Medicaid information bulletins are also published and out there, and those bulletins provide policy updates and other helpful information that our division would like providers to be aware of. So want to encourage you to utilize those resources. Okay, we have some questions that were submitted to our office ahead of time. And we thank you for taking the time to do that. The majority of the questions that we had come through were related to the topics that we actually were presenting on today. The explanation of benefits, the third-party liability and the payment, as well as some security profile requests. And there are some policy questions as well. So let me just pause there for a second. How about the TPL reporting? I know there's been a lot of questions around that. And in the past, the legacy system may have allowed for some data to come through that didn't correctly total the total claim charge. And I know with the PRISM system, all of those submitted charges and the patient responsibility, TPL payment, coinsurance, deductible, and all that has to mathematically equate to the submitted charge. So we just want to make sure that you guys are checking for that before you submit TPL information. Are there any questions that we can answer for you on TPL that weren't addressed on the slides?
Okay, I just have a question going back to what Emily was doing on filling out the form. Our clearinghouse has not been sending our dental claims for some reason. And so I've been trying to input them manually, but now I'm on the secondary ones. I know how to do the primary, but the secondary ones are giving me a little problem because there's a couple of boxes I don't know what to put on there.
We can certainly help you with that, Lori. We can walk you through that. I know that we have other providers have had problems with not knowing what the boxes are. There is also, if we could go to the resources again, we do have a really good step-by-step. If you can see that where it is showing submitting payment information for other insurance, it is literally a step-by-step, and it may answer your question into what box you're looking at. But if not, we can certainly jump on and take a look at what you're doing and be able to clear it up fairly quickly with you.
I've gone through the step by step, and so has my coworker, and we're having problems with a couple of the boxes. If you can go back to your page that you showed for the secondary insurance.
Sure.
This
one here?
The place where we get stuck is the external reason code, I think it is.
Rita, do we have you on here? I know that we've had other providers actually have the same issue with that box.
And then the other one, I think we may have gotten that one figured out, but the COB payer paid amount. Oh no, we never mind on that one. I was trying to figure out what the other box was.
Yeah, Emily, I don't think Rita was able to join this call.
Okay, that's okay. Lori, if you
Emily?
want to, yes.
Sorry, for secondary, are you guys asking like secondary as in Medicaid or secondary as in they have three insurances, they have primary, secondary, and Medicaid?
We're talking about if they have a secondary insurance. So Medicaid is the secondary, sorry.
Okay.
So I need to know how to submit those on the portal.
So Lori, is the concern that you don't know what that adjustment code is coming from the primary insurance?
And what do we put in the external adjusted reason group code? What's that?
Right. So it's asking you for what you got on the EOB from the primary insurance. What did they tell you to do with a payment? How did you adjust it?
I think that's actually the group code. Give me 1 second, Lori. Let me take a look at give me just 1 second. And if we can't figure it out, then I'll give you a call and we can set something up for you.
Okay, because I've got a Medicaid one that's a secondary that's for medical in my hands right now that I have not submitted yet.
Okay.
Where would I find that on this form? That code?
Let's look here. So it actually is saying it is the reason code reported by the commercial Medicare payer on their remittance advice. You know, Lori, I think we're probably just gonna have to meet. I want to say it's 1, but I could be wrong. But let me get that information for you, and then I'll just give you a call and even walk you through the claim.
Okay, that would be great.
And do we have your email, or can you put it in the chat?
Okay, I'll put it in the chat. I don't know if you're understanding what's happening with our company, but we were Bear Lake Community Health Centers. This last week, we just got papers signed by Health West. So we're going to be ending up switching all of our stuff. It's going to be really fun. So I'll give you my Bear Lake email and my Health West email.
Okay, sounds good.
Okay.
Okay, thanks, Lori, for that question. Another question came through from Smiles Restored. I have rejection codes on my EOBs, but when I look up the rejection code, it is not listed on the website. So I don't know if there's someone on here that can answer that question, or if you need more specifics.
I can probably help. I know that there are some denial codes that are not actually on that. You may just need to call customer service and have them take a look at the claim with you to see what the denial reason is. Or you can call me or email me and I can take a look for you.
Yeah.
Whatever's easiest.
Okay. So, and maybe I need to meet with you too, to better understand that situation with the missing.
Yes. So yeah, we could totally meet on it, but it looks like there are some denial reasons that are actually not added to our resource that is on the website. We have had a couple of those, not many, but we have experienced a couple of those.
Okay. Okay. Well, thank you. Does that help with that question from Smiles Restored? If there's anything more, please just, Dave, put that in the chat and we'll address it. We have another question from Melanie. Oh, what's that?
Can I say something? This is Lori again. Can you hear me?
Uh-huh.
Okay. So I also do Wyoming Medicaid, and they have a similar form that I fill out. When I go to put in the patient's name or the patient's ID number, it automatically pulls up their name and their ID. So I don't have the problem of spelling their name wrong. I don't have the problem of putting in their birth date wrong, because when you're doing it, there's always possibility of human error. But then also on this question that she was talking about with the not being able to see the codes or the reason for denial, they have a place up at the top where you can click on it and it'll give the reasons for the denial up at the top. So I don't know what's different about this site because it's so similar to Wyoming's.
Yeah, they're similar products, but different.
Okay. So we would just have to call to find out why it's denied.
Yes. I know that I've actually asked if we could put a spot in for a future enhancement on you guys actually seeing the reason codes like we see them, that are a little bit, they're more detailed than what you're actually getting. I probably should check and see where we're at on that. I know that they were talking that it is possible and just not giving you all of the access that we have, but it could be a possibility. Otherwise, if you get your reason code, you will have to go to that crosswalk on the website, and it will actually give you the way we see it or the edit that we see it. And if we need to meet, then I'll show you exactly what I'm talking about. And it may be easy for you to just print that up. And when you get your denials, you can just go straight to that crosswalk. That may be helpful as well.
Well, what I've been doing is I've been putting in the claims, and they if they're accepted, they go through quite immediately.
Right.
And then when I get the EOB back, then I can look at the EOB and the codes will be on there and it'll tell the reasons for it. But when I usually, after I put in the claims, I will go back and I will look and see how many got denied. So I know if I need to resubmit something, but I can't get that information until I get the EOB back.
Yeah, that's correct.
All
Thank
right,
you for your help.
Mhm.
You bet.
All right, Emily, this may be another one for you. From Melanie, am I correct that the secondary claim does not need the primary EOB attached? You just
You are
went
correct.
through that at the beginning, right? That dental claims do not require attachments.
Right.
And then another question that secondary claims do not, oh, that's the same question. They just need to be sent electronically. So, all right. Thanks, Melanie, for that question. I don't know that they're experiencing the same challenges that you did with the payer ID field, but if that is a question on this call, we're happy to address it. If anyone's having any concerns with their clearinghouse and the payer ID, we can walk you through that. BKP Dental also, how we view all detail claims in the ERA if there is more than one claim on the ERA, and how do we see detail line code on an EOB? Is that what you were talking about, Emily? Is that there are certain data elements that are visible to the customer service reps that may not be visible in the profile that the provider sees on their?
It very well could be, or it could be that they're not actually able to see the line detail on the remit, where before in Legacy, they would see line by line. They could see that. That could be it, that they're not able to see it that way.
Is it something that we do provide on the EOB and it's just a profile?
You know, I'd have to see how they see it on their side. I don't have the provider profile.
Okay.
On our side, I can see that. I can click into the claim and actually, view it on the denial on the EOB, but it could be something that they actually don't have access to. And then that would be something we may have to talk about as a future enhancement, that they may be able to get that.
Okay, so I think a lot of the questions that sounds like that are coming through are questions that your customer service department should be able to address, that you've got them trained on these specific areas. And is that your recommendation, is to contact customer service? And if they're struggling with the question, you want them to contact you or one of your leads?
Yeah, absolutely.
Okay. Thank you. There were some policy questions that came through, and we wanted to address those on this call with one of our policy reps, but I know that the one person who we needed is out of the office today. So the policy questions, if you've submitted anything that has to do with the codes not being set up correctly, or if it's policy related. I know there were some questions that came in regarding prior authorization. And maybe with Smiles Restored, I think they're on this afternoon's call instead of this morning. So maybe you didn't hear what we directed on that one, but the pre-authorization questions or questions that have to do with the claims for exam and x-rays are only paying for the exam and the x-rays getting denied. Those are policy questions. And on the resources in our training, you can see the policy email right there. The DMHF medical policy at utah.gov. We will forward these questions over to that group, so you don't need to contact them a second time. Their office director is aware of the questions, and Kirk, who is the dental policy specialist, will reach out to you when he is back in the office. But all other questions related to policy can be directed there. Most of the questions I think we've already addressed through the TPL conversations and the EOB. Are there any other questions that you have for us that we can help while we're on this call? Annette has her hand raised.
Yes, thank you.
Okay.
I was on viewing mode only.
Okay.
So a question, I need to do a corrected claim on the EOB. I looked up the denial code and it just said something didn't match. So I called the patient and she says it might be with this other added last name she had or something. So do I need to go do a corrected code, or do I just resend the claim again? How would you like that handled?
Did the claim deny or did the claim pay and you just need to correct something on it?
No, it denied it didn't pay because it said that like the ID, their subscriber ID and their name did not match.
Perfect. So that's actually easy. Just send a new claim.
Just
with-
send a new claim.
Yep.
Okay.
Yep.
Mhm.
Thank you.
And Annette, if you would like, there is some specific instructions in the December 22 Medicaid Information Bulletin that walks providers through the payment void and adjustment situation. If you would like more information, you want to put your email in here, I'm happy to just send that link to you as well.
Thank you.
Uh-huh. Okay, Dr. Becker, you have a question?
I don't think I'm smart enough to have a question. I just want to say thank you. This has been very helpful, and we've had some, from this morning's session, we've already had some positive feedback. We just want to say thank you for your help very much.
Yeah, that's really good to hear. Thank you. Yeah, we're all just trying to get through this together, and I think the more that we can communicate and create, these touch-based trainings or meetings, and if you hear anything more from the provider community, especially on situations that might be, a continuous problem, like with this call, it seemed like we had EOBs and TPL were the hot topic. So if you hear of anything else, that's coming up, we'd like to know so that we could build a training around that. So thank you for those comments. That's really nice to hear.
Yeah, thank you, Dr. Becker. There was a question I saw just come through. Shandy, I know BKP Dental was one of the ones that looks like they don't have their microphone. But their question is when I fill out a form for a PA and close by mistake, how do we come back and add more information or an attachment?
Yeah, and I'm not sure if there's anyone here on this call today that can answer that question. The prior authorizations go through the policy department. We do have Jolynn on here, and Jolynn, I don't know if this is something you can help with or if we need to forward this over to Jim. Do you have any thoughts on that?
Yeah, that's probably one we'll need to send over to our PA team and have them take a look at. And then, so we'll add that as one of the questions to our Q&A list, and then we'll provide a response back on that.
Jason, I do know, I do believe it's in the second section. It does offer you a tracking number. If you're not able to finish it, I have been able to go in to the system and use that tracking number to finish filling it out.
Okay. Yeah, we can provide them with the details then. So thanks, Becca. And then I think Annette had raised her hand again.
I would like to know where to look at when I do eligibility, like it'll say non-traditional, traditional, emergency only. Where can I access the benefits for those patients?
No, that's a good question. Does anybody want to explain that? Becca or maybe Emily on how to check?
I know different profiles allow different access. And so if you're actually with your member and you're looking it up, there are different options in the show menu. Emily, do you remember which option it is in the show menu that pulls up their traditional, non-traditional?
I'm not really sure. And I think what's happening is if you, and maybe Brian was going to say this, if you get onto the online lookup tool, it's actually a little bit easier to read of what they have on their benefit plan rather than seeing it in Prism. Sometimes you can get confused in what they actually have. So I suggest you use the website and do the online lookup tool. It's pretty clear on what they have. Brian, is that what you were going to actually suggest?
Yeah, exactly. Thank you, Emily. Yeah, the eligibility lookup tool, I'll link it in the chat. But it does describe if they have dental benefits. There are other ways. Oh, sorry. Rearrange my screen, and there are other ways to check eligibility as well, including 270, 271 transactions. If someone's interested in that, we can talk about that. But eligibility lookup tool is a good option to see those benefits.
So
And-
don't go to the Prism portal for that? Because when you first pull up Prism, it has the little boxes and it'll say eligibility tool lookup, and that's how I go into it. But I don't know what's covered on non-traditional versus emergency versus traditional.
We've been directing the providers to use the ELT lookup tool as the source of information. That's what the system is using to validate the data that's coming through. So that would be my recommendation.
And I think she might be asking literally what is the difference between what's offered to traditional versus non-traditional versus other programs, which could be just in the manual themselves, right? In order to look up what the actual benefits are, or to use the tool where you put in the specific CPT code to see whether that is covered.
Yes, that's what I'm thinking, because I just thought there was traditional and emergency. So then I'm pulling up people's, lookup, and I'm like, well, what's on non-traditional? I don't know what they pay for.
Non-traditional does not have dental benefits aside from the emergency dental coverage. So non-traditional, you may see it has a set of slightly reduced benefits for medical side, but in terms of dental services, it is exactly the same as emergency. There's like 6 codes, and the link that I provided in the coverage lookup, you can look code by code to see for a non-traditional member, is it covered, or for traditional EPSDT, there's children under 21 or pregnant women, if it's covered, that gives that level of detail for codes.
That's helpful. Thank you.
Yeah, thanks, Brian. Looks like there's one last question here from Smiles Restored, and I did copy your questions and put them in our spreadsheet to document who they are going to. So as long as the contact information is correct on those, we'll get back with you on it. But I think we may be able to answer this question for you. So the procedures have been prior auth, but you get denied stating the auth number is incorrect. Emily or someone else, do you want to explain, like there's another auth number, right? Isn't it? Not an auth number. Is it the transaction ID? How do you want to explain this?
Well, with dental, it's a little bit different. There's with different programs, there's a transaction ID that they may have. I guess maybe what I'm wondering is it saying that the authorization is incorrect, or is it saying the authorization is not on the claim? That's a little bit different. And I think that for me to really know what it is, I'll have to look at the claim. Now, if it's your clearinghouse is wiping that prior authorization, that's actually an EDI issue where Diana then needs to get involved with maybe kind of an education on where the prior auth is in the, help me, Diana, loop or
right, loop or segment. And
yeah, right.
Yeah, to make sure they're sending the right qualifier, because in the early days we had I can't remember, Dental Exchange sending the G3 qualifier when it really should have been the G2. I haven't seen that in any other clearinghouse, but that doesn't mean it couldn't come from any other clearinghouse. So definitely get us some examples and we can take a look at the raw data and see what's coming through.
Yeah, that would be best. Let me look at your claims and then I'll be able to help you a little bit better.
And it may look to see if they're recent claims, because some of this work that Diana's done with the clearinghouses has happened over like the last week. And so that may have already been corrected. If you try to resubmit those, they may go through at this point. There was a lot of work that she had done to get. So the data wasn't getting from the clearinghouse to Prism. And so that was part of the process that we had to go back work with clearinghouses to get that type of information to flow through.
Right. And it's actually been corrected, I think, for probably a month. Maybe it's hard for me to remember exactly, but it's been a little bit now. So if you can get me in some examples, I can take a look. And the only clearinghouse I'm aware of is Dental Exchange that was having that specific issue. So if you're using a different clearinghouse, it could be that, or it could be something else. it's more likely that they're wiping it rather than using the wrong qualifier if it's not dental, if it wasn't dental exchange. But if you send one today for dental exchange, it comes with the G2 qualifier without an issue. Well, I'm assuming without an issue, because there is G3 is a valid, if you're sending a predetermination, we just don't accept them without getting too more detailed about that piece of it. But certainly give us some examples and we'd be happy to take a look.
Thank you. And just again, on the screen there, you'll see the contact information. So EDI, there's their phone and email. And if you're trying to reach customer service, you've got theirs. Okay, well, we are 4 minutes over time, so we need to wrap up quickly, but we wanted to just tell you thank you very much for taking some time this afternoon to meet with us and share your thoughts. If there are any other items you'd like to see us present on in the future, we'd love to know about that, or any improvements that we can make in any training modules or documents that are on the website. Please reach out and let us know. Jason, do you want to conclude the meeting for us?
Yeah, I just want to thank everybody for their participation, and we'll, like I say, we'll be sharing the documentation from this one out with folks. We'll send out an email that will have the address to both the links for the meeting recording and also the questions that we received, and then our responses back to those questions. And then we'll also be sharing this presentation with everybody. So just wanted to thank you guys all for your time and work as we transition to our new system. So.
Yeah.
Thank you.
All
Thanks so
right.
much.
Have a good
All right, thank you,
afternoon.
guys.
Thank you.
Have a good
Bye-bye.
day. Bye-bye.
Bye.
Thank you.